Every American needs to be interested in healthcare disparity because simply it affects us all. And I'm going to be honest with you, this, due to American ideology and culture, sometimes is a hard sell. But let me say this simply. The Secretary of Health and Human Services, Kathleen G. Sebelius, said, quote, "Health equity benefits everyone. Every person who dies young, is avoidably disabled, or is unable to function at their optimal level represents not only a personal and family tragedy, but also impoverishes our communities and our country. We are all deprived of the creativity, contributions, and participation that results from disparities in health status." Additionally, I add, for those of you who aren't sold on that, if health disparities continue to widen, where you have a huge percentage of the population that is sicker and therefore needs more help, more health care, that inevitably leads to higher costs. We are all right now fighting, or we are all right now realizing how expensive American healthcare is. We've all heard the stories of people having to mortgage their homes to pay for healthcare. Yep. Every time people come to their clinics or their hospitals, or they're in their HMO systems, and they're entering the doors sicker with less preventative medicine, it costs the United States citizen more money. So if we're able to lessen the gap between people, regardless of their race or their socioeconomic status, we can actually start to chip away at the overall cost of healthcare. This is something that people don't realize. And this is something that if we start to really talk to the US population about this directly and not hide it from them, they'll have a better understanding as to how disparity affects them, even if they don't consider themselves part of the gap that's being left behind. We all can benefit from reducing healthcare disparity.